I'm Emily from the Emerging Minds Network. I'm really pleased to welcome you to this Open Lab meeting on neurodivergence and mental health. How do we embrace complexity? So I'm really pleased to have Georgia Harper joining us today, who's the policy manager at Autistica and also the lead for the Embracing Complexity Coalition, and Dr. Suzi Sapiets, who's a postdoctoral research associate at the University of Kent. And we've been so delighted to work with both Georgia and Suzi through the Emerging Minds Network on kind of a number of things, but including a cross-sector placement and also a special interest research group.
Hello everyone, thanks for coming. So as Emily says, I lead the day-to-day running of the Embracing Complexity Coalition, which supports people with a range of neurodevelopmental conditions. We'll talk about what that is in a moment. First of all, we wanted to, I guess, look at what neurodivergence is, and you might hear slightly different words or slightly different definitions from different people. At Embracing Complexity, we define a neurodevelopmental condition as any lifelong condition generally present from the early stages of life, which affects the brain and influences how people think, perceive the world, or interact with others. Basically, people who are neurodivergent have brains which are a little differently wired from most people. We say neurotypical people. Unfortunately, people who are neurodivergent often face barriers in society as a result. And as you'll know all too well, real life human brains don't always fit exactly into these fairly haphazard and arbitrary labels that we've set up for them. Real brains might fit some criteria for diagnosis, but not others. They might fit the criteria for one condition and also have a few extra differences that don't necessarily fit anything else. And more often than not, people who are neurodivergent meet criteria for multiple neurodivergent conditions. Co-occurrence is the norm, not the exception, but diagnosis systems, services, and policies often aren't set up for that. So neurodivergence is a part of who a person is, and I wanted to cover off now that neurodevelopmental conditions, neurodivergent conditions, are not mental health conditions. But again, most neurodivergent people meet the criteria for co-occurring mental health conditions. Here are some of the most well-known neurodevelopmental conditions, although there are many more, and some of the mental health conditions that can be associated with them. For example, there are really strong links between Tourette syndrome and obsessive compulsive disorder, and between autism and anxiety. Many of these conditions are under-researched, so there is still a lot that we don't know. So why are neurodivergent people so much more likely to experience mental health conditions? Well, like many aspects of neurodiversity, it's nuanced and it's complicated. Some neurodevelopmental conditions, though not all, have a genetic element that might also mean the person is predisposed to certain mental health conditions. Another huge factor is, frankly, the stress and trauma of being different in a world that doesn't accept difference. Sadly, a range of studies have found that neurodivergent people are more likely to face adverse childhood experiences and other negative events throughout their lives. Some neurodivergent conditions and differences in the way the person thinks might also mean that someone is more predisposed to developing certain mental health conditions. So for example, in autistic people, anxiety has been linked to things like sensory differences and difficulties managing uncertainty. That is, a part of autism. Neurodivergent people are also sadly disproportionately likely to have other experiences that are linked to poor mental health. We know that due to barriers in healthcare, many face inequalities in physical health as well as mental health. They also might face barriers to employment, which can in turn lead to poverty, which we know has a huge impact on mental health. And those in other marginalised groups, those marginalised by race, gender, sexuality, etc., will have those difficulties compounded further.
Okay, so there are sort of several practical challenges to supporting neurodivergent children and young people's mental health. And these can be understood as barriers of access to support, both sort of general access to support across service systems, and then also specific to obtaining support for either neurodivergence and or mental health. And one way to sort of conceptualize these is to look at a pathway of access to support where there's recognition of need, which could be, you know, an emotional or mental health need of a neurodivergent individual. The second stage is then identification or diagnosis of that need, such as a professional formally identifying that the individual is struggling, or a diagnosis of a mental health condition. And then the third stage would be provision of support, which could be giving anything from giving information and signposting to actually providing mental health support, such as counselling, therapy, specialist interventions, medication, and so on. And this isn't always a linear process, so barriers can sort of prevent progress across these steps. And also provision of support isn't always the end, as the individual may need further support to meet the need, or they may return to an earlier part of the process if another need is suspected or if there's a sort of change in circumstances. So across this sort of pathway, there are many barriers that can prevent mental health support for neurodivergent children and young people. And I've listed several on the slide, which are just sort of it's not an extensive list, but it can give some sort of idea of some of the challenges. So, for example, these things at the top are more to do with the individual who is neurodivergent, so factors to do with them. So, for example, we know that neurodivergent people often show their emotions or show their emotions differently, which we can refer to as differential presentation. And so we might not be able to recognise or diagnose mental health as easily when we're comparing to sort of people who are not neurodivergent. Another challenge is that many neurodivergent people have difficulties recognising and labelling their own emotions. They may also mask or camouflage their needs in order to fit in, and have things like communication differences, which is quite a key one when we're thinking about sort of identifying and supporting people, as a lot of mental health assessments and support are based on verbal communication skills. So if somebody's not sort of able to verbally communicate, then that can be one key barrier. Some of the things down here are more to do with other factors that are related to, you know, people who are supporting the person or their family, different professionals, services and systems. So it can be things like fixed views on what mental health conditions look like, which can sort of prevent them recognising if there is a need for support. Limited expertise, knowledge or skills, especially within professionals. Often we're focused on one sort of specific area. So we might be focused on autism, or we might be focused on mental health, or we might be focused on ADHD or learning disability. And so that means that sometimes we won't all have the experience or knowledge or skills to, you know, recognise and support people with a wide range of neurodevelopmental conditions. A lot of the times when somebody's diagnosed with a condition, there's something called diagnostic overshadowing, which is where everything is attributed to that condition that they've been diagnosed with. So if somebody's diagnosed with autism or a learning disability, sometimes some behaviours or emotions might be perceived to be because of the autism or because of the learning disability, which means that we would sort of miss when there might be a need to support mental health. And then there's things like misdiagnosis and unclear care pathways. There's There's a lack of standardised mental health assessments for neurodivergent people. As I said before, a lot of them are focused on the ability to, verbally communicate, and also to be able to sort of understand and recognise emotions and talk about them. And then more to do with sort of services, there's a lot of services just focused on one area and have sort of strict eligibility criteria. So some neurodivergent people are excluded from CAM services, for example. And then there are just a lot of inaccessible services in terms of like their location, time and cost, or non-availability of services and really long waiting lists. Support can sometimes be inappropriate, so it might not be tailored to an individual's needs, or it might just be like a short-term intervention which doesn't always address the underlying need. And there's also a lack of specialist services and sort of continuity. And these are just some examples based on the research. There's quite a lot of other ones that have been identified as well. When we're thinking about research, so in addition to these practical challenges, there's several challenges to conducting research across mental health and neurodivergence. And as Emily mentioned, these can be found in the Embracing Complexity and Research report, which is on the Embracing Complexity website, which was completed as part of a placement I did that was funded by Emerging Minds. And some of the key research challenges that we identified were a mismatch between research that's being conducted and research priorities that have been established by partnerships like the James Lind Alliance, which bring together various stakeholders, including neurodivergent people, families, carers, various professionals and researchers. So our review found that the priority was to focus on research that's on how to support neurodivergent people, yet there's indication that most research that's funded is actually focused on things like causes and genetics, which feature quite low on the priority list when they've been reviewed by various people. There's also a lack of awareness and understanding about the overlap of neurodivergence. And so, as Georgia said, there's loads of overlap between neurodevelopmental conditions, yet there's a tendency to focus on one area of neurodivergence rather than across neurodivergence, which is sort of related to research and clinical silos, where often we sort of focus and specialise in one area and sometimes can sort of miss the bigger picture. And there's also difficulties conducting research, such as inaccessible research studies, for example, those only relying on verbal communication, participant exclusion. For example, neurodivergent people are often excluded from mental health research, or some neurodivergent mental health research will exclude people if they've got more than one diagnosed condition. There's a lot of difficulties getting adequate sample sizes, especially for less common conditions. And there's a lack of standardized measurements that show good validity and reliability, and that can be used across different neurodevelopmental conditions. And because of this, a range of different measures are used, which sort of limits comparisons between different studies. And then also research funding is typically focused on one neurodevelopmental condition rather than across neurodivergence, which obviously doesn't reflect the reality that most people have more than one, albeit often without formal diagnosis of more than one. So what can we do differently? I thought it would be good to share some ideas on things that we can do differently to ensure that we're supporting children and young people. So in terms of our practical support, we can ensure that we don't make assumptions based on any preconceived ideas or opinions of mental health or neurodivergence. We can ask people who know the person well, be direct and non-judgmental, take time to figure out what's going on before diagnosing or prescribing medication, ask other professionals for their advice and support, tailor mental health support to meet the individual's needs, and also actively tackle barriers of access that I mentioned on the other slide. In terms of research, we should bring together different researchers who've got experience of different neurodivergence and mental health, so that we can sort of collaborate together. identify existing studies and also core measures that researchers can use to enable comparisons in future studies, fund research based on the priorities that are established by the community, continue to improve awareness about the overlap of neurodivergence, and also ensure that research is inclusive and accessible to a variety of neurodivergent children and young people, especially those who are often excluded from research, either for having multiple conditions or for being because they're more difficult to sort of engage with in terms of communication and so on. So what we'd like to do now is go into breakout rooms and then discuss the following things. So based on your experience, what are the key challenges to supporting neurodivergent children and young people? And then how can we improve practice and research on neurodivergent and mental health to ensure all children and young people are supported?